2.0. Welcome and thank you for joining us for the first regional quarterly collaboration call of 2022. I hope everyone is well and staying warm this afternoon. Here in Ohio, we all know it can get pretty chilly here. I am joined here today by other members of the grants administration team. They'll be working with us on different aspects. Some will be presenting, some will be monitoring the chat, as well as our regional presenter for today, and members of the SARDI team at Wright State University, which will give us our update for data collection and evaluation regarding the SOAR 2.0 grant. Today, we will be covering the Twin Valley region of Ohio, and the project lead for this region is Ashley Murphy, who is the project coordinator for SOAR 2.0. As we get started here, we're going to go over some general housekeeping items. Next slide, please. This meeting is being recorded and may be posted for the at the Ohio MAS website. Please be kind to mute your computer and or phone if you're tuning in by telephone, and turn off your camera throughout the duration of the presentation today. We are utilizing our chat box for today's meeting for questions, comments, and to provide vital links for our presentation today. The chat box is moderated by one of our staff. They will be answering the questions as promptly as possible, or holding off on those questions to have other staff answer it throughout the presentation or at the end of the presentation. You can also use the box to ask questions for the presenter as well when we get to that point. The Ohio MAS website for federal grants and projects contains FAQs and additional information about these projects, and use the link below. We do have a new website, and we'll talk about that a little bit later on in the presentation. At that link right there, you will have access to the various projects and grants available here at Ohio MAS, such as SOAR projects, block grants, discretionary grants, as well as the list of Table B on the website. Today, we'll be doing a quarterly collaborative call survey at the end of our meeting. And there is the link there. We will put that link as well in the chat. Please take about 5 minutes to complete the survey. It just asks some general questions that help us here at the Bureau of Grants Administration understand whether or not we've met your needs today, what other information that we can obtain to help build presentations for future collaborative calls here in the state, and overall just get some general information about what's going on with the projects. So we do appreciate your time doing that survey today. Again, there is the link and it's in the chat box, and I'll provide a reminder at the end of the presentation as well. Thank you. Here we have just a quick overview of our grants administration team. We are a growing team. Here you'll see the staff, their roles at the Bureau, and if they have a specific grant or lead region that they are representing. As I mentioned earlier, Ashley Murphy, the project coordinator, she does the project lead duties for Northwest and Twin Valley regions. You'll see there we have the Chief of Grants Administration, Dr. Alloy, and this is a good segue for me to allow her to give our opening remarks and address everyone in today's meeting. Dr. Alloy.
For calling me out of my other meeting to make my opening remarks. We are so excited to be kicking off this regional collaboration call in the new year, and the department wants to extend a note of gratitude to all of our partners who have been serving during this extraordinary moment in history. We understand that this has been unusual, and at the same time, the needs of our clients have not changed. And we want to let you know that we really appreciate the roll up the sleeves, get the work done effort that has been displayed on the part of our boards and our providers. We understand that our clients are in high levels of need right now. And not only do we have a global pandemic, we have already been working on this opioid crisis and epidemic. So the department wants to extend gratitude and grace. We understand the difficulty in standing these programs up, the staffing, the workforce implications. And we just want you to know that we know that, we acknowledge that, and we appreciate the partnership and the continued work and service. I actually get the easy part in these meetings, which is really just to do that wonderful opening, because the real conversation that follows about what you all are doing, what you're experiencing, the department is listening with a laser focus on what aspects of this service delivery network need to be sustained and where we should be finding additional funding, procuring funding to support the parts that are working that need to stay working. So the dialogue that's going to follow in the meeting today is very important for us so that we understand from the boots on the ground what parts of this should be sustained and where we need to be looking for additional dollars and new opportunities and best practices. So again, I just thank you on behalf of the Department of Mental Health and Addiction Services for your service, for your dedication, and know that we extend grace and gratitude as we continue to work through this most unusual period in our human history. Thank you, Phil.
Thank you, Dr. Alloy, for that warm welcome to our meeting today. Moving forward with SOAR 2.0, I wanted to start off by saying thank you for all your hard work in making SOAR 2.0 Year 1 a successful year. SOAR 2.0 Year 1 is effectively called, you're on the chat there. There we go. Is effectively called SOAR 2.1 here at the Bureau, and in reference of Year 1, and SOAR 2.2 in reference of Year 2. So you might hear us use 2.1 and 2.2 within the presentation today, as well as any communication we might have with the field going forward. With that said, 2.1 of SOAR ended on September 29th, 2021, and 2.2 began on September 30th, 2021, and will run through September 29th, 2022. The closeout process for SOAR 2.1 was a successful process, and we will continue to move forward with this process in the fall. In the fall, at the end of the grant period, we will disseminate reminder notices and information regarding this year's closeout process for the current year. In regards to carryover, the department did submit a formal carryover request to SAMHSA and is currently awaiting for processing. It is our hope that we will learn more about this request in coming weeks or hopefully months. And we'll give that information to you as soon as we obtain it. As a reminder, any carryover requests that we do receive are not returned to the original awardee, and that Ohio Mas senior leadership does have the final decision on how carryover funds are awarded. In regards to mid-year reports, just as a reminder, our mid-year reports are due in March. The date will be March 11th, and the department will be sending out narrative forms for people to complete. Hopefully sometime by the end of this week. If not, first thing next week, you should get those in your email box. Please use that template to provide and submit your updates. It's several questions long. Just ask about how your project is doing, project years, and things of that nature. If you have any questions about the mid-year report, please feel free to reach out to myself or your project leads, and we'd be happy to help you with that information. Next slide, please. So for SOAR funding statements, we are wanting to remind everyone that there are formal items that we need to put on anything that is in print, in media, or training materials that do follow disclaimers that should be in small print on the item in some capacity. Please reach out to your project lead for copies of these statements, as well as official logos from Ohio Mas and SAMHSA. For those that are tuning in through a phone today, I will read the examples that I have on the presentation. This publication and/or program was made possible by grant, and we list our grant number there, from SAMHSA. Its contents are sole responsibility of the author and do not necessarily represent the official views of SAMHSA. The other example is funding for this training was made possible in part by the Ohio State Opioid Response, SOAR. Again, it gives the grant number from SAMHSA. The views expressed in written conference materials or publications and by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does mention of the names, trade names, commercial practices, or organizations imply endorsement by the U.S. government. If you have any questions about the funding statements, again, please reach out to your project leads. Or if you have any questions currently, you may put those into the chat box and we'll answer them as promptly as possible. In regards to the SOAR 2.0 website, in October, the entire Department of Mental Health and Addiction Services did launch a brand new website, and that did generate a new homepage for the SOAR projects. Listed below is the link directly to the State Opioid Response. We will put that link into the chat for you as well. On the website, you can find information such as the Community Investment Guidebook, which we are working on updating for year 2. That should be updated and on the webpage shortly. Information updates, regularly updated FAQs, information and questions that are answered in these chats are updated and added to our FAQ section for our website. Reporting requirements and the link to Wright State University's SARDI program. If you click on their link, it brings you to a website with a couple square tiles, and you can click on things such as GIPR consent forms, training information, and dates, etc. We do also have a calendar of events. That calendar does include things like the regional collaborative calls that we're on today. Our next regional collaborative call will be in April, and we will send out reminder notices for that sometime in March. The GIPR training, and Sardi will be talking more about that later in today's presentation. And you'll also find a list of allowable costs. Again, there is the website, and if you have any questions, feel free to put them in the chat. With that, we'll move on to SOAR 1.0, the NCE. So the NCE, or SOAR Prime, officially ended also on September 29th, 2021. We at the Bureau want to thank everyone for their amazing and hard work that was completed under this grant. We were very impressed by the amount of Ohioans' lives that were touched by each and every one of these projects. The Bureau did complete a 3-year grant report and submitted it to SAMHSA in December. To date, we are expecting to send back less than $1.9 million to the federal government, and that is in total for all 3 years of SOAR Prime or 1.0, and that includes the supplement. So that is such an amazing feat and accomplishment, and each and every one of you should be very proud of the work that was completed under SOAR 1.0 NCE. So I'm going to move forward, and we're going to introduce Christine Sealski. She is the Assistant Chief of the Grants Administration Bureau, and she'll provide some updates regarding the end of MAPADOA. Christine?
Thank you, Philip. Good afternoon, everyone. It's so nice to see everyone on the calls today. I want to first talk to you about the MAPADOA grant. This grant did fulfill a lot of really important work that's made a big difference in the lives of Ohioans that have OUD. And all of the success of this grant does show your dedication and your work for Ohioans. The MAPADOA grant, like several other grants, did end on September 29th, 2021. And we had very little funding that we sent back to SAMHSA from this grant. So thank you for working so hard to use the funding in your local areas. There is no further funding for the MAPADOA grant, and there is no future listing for MAPADOA in SAMHSA projects. So now I want to switch gears a little bit and talk about the RSP grant. The RSP grant is a regular services project. This was a combined effort between FEMA and SAMHSA. It was fashioned after the natural disaster model, and it dealt with COVID, and it also dealt with COVID stress. Sorry, a little lost for words. But the RSP grant did close on October 24th of 21, and you'll see in the next slide that the grant did outperform what we had said in our application. In our application, we did say that we plan to serve about 47,000 individuals. And after the end of the grant, we did serve 651,159 individuals. There were 13 boards in 19 counties that participated in this particular grant, and we used paraprofessionals in local agencies to do outreach and referral. And they went over and above and beyond for this grant. They not only did outreach and referral, they went back and did an additional outreach to make sure people were able to get to the referral source, get what they needed, things from food insufficiency, behavioral health, substance use, transportation, whatever it is that people were being stressed with COVID. It was put together as a resource package in each location, and many of the boards did use their emergency lines for people to get information. We had wonderful support from the faith-based community, a network of pastors and other religious individuals who provided information to their congregations on how to get the help through this grant. So the impact stories that were sent to us by the individuals working on the direct service part of this grant provided that emotional connection that helped us, that the individuals working with the data, to see the emotional side of the grant work. And impact stories have such a big presence in the work that we do at the state, at the boards, and at the local level. And SAMHSA always appreciates getting them with our reporting also. And so I want to take a moment to just really thank everyone who worked on this grant. There is no renewal for it right now. There, COVID hasn't gone away, but there are other funds that, have been released for COVID. So thank you so much for your hard work. And this will be the last time that we probably talk about the RSP and the MAPADOA grants. So take care, and I'm going to give the floor back to Philip.
Thank you very much, Christine, for those updates with RSP and MAPADOA. With that, I would like to introduce Ashley Murphy, and she will give you an update on the Twin Valley region. Ashley?
Thank you, Philip. Good afternoon, everyone. As some of the other presenters mentioned, I just wanted to take a brief moment to say thank you for taking time out of your busy schedules to join the Twin Valley Regional Call. It is so great to see so many familiar names and faces on the call today. So for today's SOAR Regional Highlight, I would like to welcome the Alcohol and Drug Freedom Center of Knox County. If we could go to the next slide, please. Afet, their executive director, will be sharing some of their SOAR project successes, as well as some of the challenges and barriers they've experienced over the past year and how they've begun to address those issues. So Afet, please feel free to unmute your microphone and turn on your video at this time.
Thank you, Ash. If you can go ahead and get my slides on the screen, that will be wonderful.
All right. Would you like the next slide up? Valerie, can you go to the next slide, please? There we go. Thank you. All right, the floor is yours, Afet.
Hi. Thank you, Ashley, for the opportunity to showcase and share about our community-based MAT project, supported by both SOAR 2.1 and 2.2 community organization grant. I'd like to start out introducing the Freedom Center to everyone and sharing who we are as an organization. So Freedom Center is a not-for-profit community mental health center The agency was established in 1977 and has been serving Knox County and the neighboring counties for the last 45 years. We are accredited by CARF and certified by, of course, Ohio MHAS to provide intensive outpatient programming, outpatient program for mental health and substance disorder treatment, SUD case management, prevention. We also provide population-specific programs. We serve children and adolescents, and we have women's specific programming. Additionally, we have services for family support. We do participate in all of the drug courts in our county. There are 3 different drug courts. We have a jail linkage program that is being supported by our MHR board. We recently added medication-assisted treatment thanks to the grant, and also we offer now psychiatry and medication services. We are located near downtown Mount Vernon. We are in the National Historic District, we love our historic building, which is over 180 years old. We are also a National Health Service core site due to being in a rural health professional shortage area. So in terms of the next slide, looking at our program successes. We have several successes to share and celebrate about our community-based MAT project. Starting with at the macro level, I think our biggest success was getting this project off the ground in a very short time and really successfully implementing it. So what helped us was really having some experience with the MAT. We had a small MAT program in the jail through a federal grant. And we also partnered with the local hospital, community hospital, for over 3 years, supported their MAT clinic, MAT program. And those 2 experiences came very handy in terms of being able to really implement a whole new program in a very short time. So we did the program design, clinical policies, procedures, forms. We needed to get supplies, you get the physical space configured, train the staff, communicated with the clients. We also had to terminate our contract with the community hospital. We said we want our own program. We no longer want to just be supporting their program. So it worked out. They were on board and supported us in this project. Workforce was an important success for us. Again, we are in a workforce shortage area, and we have COVID going on. And it is a huge challenge to be able to recruit staff. But we were able to recruit a physician to serve as our medical director to oversee the program. We also recruited a local OBGYN physician to provide services, and also another local nurse practitioner to provide direct services. So we were very fortunate to have a really great medical team. Our LPN nurse and also our MAT coordinator, who's a CDCA, they all make up the core team, and they do a really great job. Another success for us was really using telehealth. We had no experience with telehealth prior to COVID-19, just like a lot of the other providers. We were forced to implement telehealth in a short time. And it came very handy as we got this program off the ground. We still utilize telehealth on a regular basis to maintain continuity of services and improve access as the COVID-19 pandemic, of course, ever keeps evolving. We do use video, telephonic, as well as asynchronous telehealth means to deliver services in the program. We have a lot of very positive program outcomes. I'm very proud to share this information. So overall, the program really improved access to MAT services in Knox County, and it is very much needed. Our program is one of the probably most comprehensive MAT program. We offer Suboxone, Sublocade, oral naltrexone, and Vivitrol. The only thing we don't offer is methadone. We do provide referral and linkage to out-of-county providers for methadone when we have clients that really will benefit from that. So when we started the program and working with the hospital, the program averaged about 50 clients at any time. So after we transitioned the program to the Freedom Center and used the grant to grow the program, now we are averaging 85 to 90 clients. And we think we will be probably, if not tripling, doubling before the end of this grant this year. So this is very exciting that we are able to, again, create a lot of access and make it accessible to a higher number of people. So we used to provide the service once a week, and we had only one provider in the program. Now we provide the service three times a week, and we have 2 different providers. And we think we're going to keep increasing the availability and the and probably try to have it this 4 days a week, and increase the time that our providers are spending in the program. 96% of our clients did not have criminal justice system involvement, or they did not have any new charges. So there's a high rate of clients really, not having any criminal justice issues while they're in the MAT program. That's very encouraging. We also see a high employment rates in the program. Over 54% of our clients obtain employment and maintain employment. So that was really very exciting to see. So program also increased access to naloxone. This came through our HRSA federal grant. We were fortunate to receive a Rural Communities Opioid Response Grant from HRSA, and we are a little over a year now into the grant, and we used a lot of the money to really purchase naloxone to make sure that that was available to the community, and I believe that that is making a difference. Although overdose rates are going up, we are seeing the overdose-related death is remaining stable. It's not going up. So during the program, the grant year, we had no active clients referred to us for overdose through our ORT team in our county. So that's a good sign. As long as clients are staying engaged and receiving the service, we are not seeing them really be at risk or huge risk for overdose. The last thing I want to mention is that the MAT program clients also have access to LPN nurse for health education, as well as infectious disease screening. We offer HIV, Hep C, as well as pregnancy and diabetes screenings to the program clients. So these are some successes, highlights from the program. Now, in terms of the challenges, we do and we have faced multiple challenges. Again, going back to the workforce, it is the most critical area, and it still continues to be a critical area for us. We were not able to recruit a RN program director. We tried very hard, spent a lot of money actually advertising for a program director position and an RN, and we were not able to even get a response to the ads. So that was very challenging. We had to shift the responsibilities to the clinical director, so that added burden, of course, internally. COVID-19 has been a constant challenge, and I know everybody can relate to that. We have certainly experienced increased cancellations, no-shows. Of course, we had safety concerns as well. Another challenge was when we implemented the new program, MAT service, the program really further exposed the limitations with our HR system. So our HR system was not really ready or didn't have the capability to do all the things that we needed to do to support this service, this program. So we're still actually working on this, in terms of making sure that we have the proper coding and the documentation and the templates and, in the HR system to be able to support the program. Also, as an organization, since we haven't really provided any medical services previously, we lacked the expertise in terms of, which codes to use, how to bill, how to document these new services. So we had to invest in some trainings for staff and leadership to make sure that we were able to code, bill, and document these new services. Physical space is a huge challenge for us. You saw our building. It's a very old building, over 180 years old, and it's not designed to be designed to meet our needs. basically. It was a resident, and we turned it into an office facility for us. So we are hurting for space. We were able to use telehealth and work at home to stretch the space for us. However, as we hire new staff and grow the program and increase the capacity, we are struggling with physical programming space, and we're working on a different project to address that issue, but that has been a challenge as well. Competing priorities. So I know everybody's busy, probably wearing multiple hats, just like me here. So that has been a challenge as well, because here we were trying to implement this new project, while we had a bunch of other grants and projects and areas that we also needed to focus in. So that is really, for a small organization like ours, it was challenging, but we look at it as a growing pains, and we welcome it, and we keep going, we keep working on it. Another area that I really want to touch on is just how much stigma or biases we encounter, especially being an MAT provider, and that I see this on a regular basis. I think every week I hear something about MAT, and it tends to be stigmatizing and negative, I guess feeling toward it. So, and I experienced this from our existing partners, community at large, even clients. They do express they do come to us with a lot of internalized stigma. And in fact, just last week, one of my own patients who decided to go off Suboxone on his own and didn't work out very well for him, of course, he came back and he's on track now, he's doing well. But his family members told him it was not good for him, he should just stop. And in fact, his father told him that Suboxone was a government subsidized heroin. So very strong negative stigma. And again, we hear different shades of stigmatizing language or comments from the community. And we are working on addressing this, especially, I think, staffing wise, our staff is very much on board. And that has not been an issue, although it could be internally. I think in an organization, staff need to be maybe trained, educated, but we are seeing more with the external partners as well as within our population, our clients. So we are doing a lot of education with clients and family members to address that. It does become a barrier. Biases, we see biases as well. For example, law enforcement or other entities possibly. They prefer, let's say, withdrawal. And sometimes they ask or require that the client doesn't get on Suboxone or Sublocade or some of the other options. So we do get that kind of a bias, negative or positive, depending on the drug we're looking at. So the last thing I want to share is the sustainability. I know that is a challenge and will be a challenge, especially when the grant ends in September. So we need to figure out a way to really make sure that as the program grows and evolves, that it is sustainable. It is an expensive program because we have, medical providers that are, it can be very expensive for a small organization like ours to support medical staffing. So we are working on a sustainability plan and also making the program more efficient and learning more about, of course, coding and billing so that, when the grant goes away, we are in much better shape and we'll be able to sustain the program into the future. But I just want to express my appreciation to the state, OMAS, and this grant that came out of nowhere really made this possible. I do believe this program saves lives. So we are doing some life-saving, life-changing work because of the grant that we have. So thank you. I hope that we'll continue to get some kind of help into the future. And that I just want you to know about this, just help us with the long-term sustainability if possible. So I'll stop there. So if there are any questions or comments.
Hi, this is Michaela from Franklin County, Adam H. Can you all hear me okay?
Yes.
Thank you so much for sharing off it. I really appreciate all of your insight and talking about your MAT services. I have a couple of questions. It seems like you've been very successful in some of the areas of the challenges that a lot of people across the state are facing. I was curious, One of the problems that some of our MAT programs are facing here in Franklin County is trouble finding people that do not have Medicaid, so that need MAT services but are not linked to an insurance company or receiving Medicaid. Have you encountered this as well, and how did you go about that if you did?
Mm-hmm. Yes, so we do have a small proportion of our clients that do not have insurance, health insurance, or their health insurance may not be adequately covering their services. So we allocated, like right now, part of our grant to really cover services for those individuals. So we have money in the budget to pay for their medications, even, pay for some other services or resources that they might need. Now, we also receive generous support funding from our MHR board. I do want to mention that, again, without their help, this program wouldn't be really successful where it is right now. They do support the MAT coordinator role, which is really completely administrative, and it's a cost to the agency. So we do look at other funding sources, including local funding sources, to kind of bridge the gap for clients who are underinsured or have no insurance. And we are in the HSC side, so we don't deny and turn anybody down. So we figure ways to, and we have a sliding fee scale as well. So we look at different options. It's really very like by case basis, very individualized. Team is very resourceful, and we do sign up for any patient assistance programs through, pharmaceutical companies, manufacturing companies. Those sometimes are helpful as well. I hope that answers your question. It's really case by case basis, and we have to be very resourceful and sometimes creative to help people.
Thank you.
Of course, the first thing we do is make sure if they're eligible for any insurance, Medicaid, that's the first thing we do. Our case management team is, usually on it, and they look at every option for coverage, and then we tap into other resources.
Thank you for sharing. I really appreciate that. For our county, the problem has been we have a lot of patients that are on Medicaid, so it's trying to find patients that are eligible for SOAR that are not already receiving Medicaid or have an insurance. So we're just curious about that. But thank you so much for your feedback. Really appreciate it.
Well, thank you, Afet, for your presentation. Thank you, Michaela, for your questions. I did notice a few comments and questions in the chat regarding the presentation. Brad DeCamp had said, hello, nice job. I appreciate your comments on the need for education to address stigma. It's real, especially with MAT. So that definitely brought up a really great point. For those who had their video on when you shared that example, I did see some head nods and just some validation that they see that as well. We do have quite a few MAT projects in the region. I know Michaela with Franklin AdamH had shared some of their challenges with implementing MAT in the community. Are there any other providers or boards on the call that have MAT that would like to share maybe some similar successes or challenges? Have you seen some of the other, the stigma, any of those issues?
This is Barbara Mahaffey from the Santa Valley Mental Health Center in Chillicothe. There's been a lot of difficult, sidestepping with working with the jails. We have two projects, one called the Jail InReach and another one called the Innovative. Right now, the COVID has hit, but the jails, it's in all the jails that we serve. But the initial difficulty was that a lot of the sheriff that control the jail population are saying, we want Vivitrol only. So there's been some juggling there. The one success that Santa Valley has really noticed in the last 3 months, especially the innovative grant that we have that also helps diagnose it's co-occurring disorders, with the substance use disorders, and with the opioids and the meth, and the mental health disorders. So that program, we anticipated serving 100 people, and it's already, we've served 56, and the numbers are growing. The requests for services for the co-occurring innovative grant have really been growing in all the counties that have jails that we serve. But the stigma is a very big challenge. Another big challenge is keeping the same people employed in the positions, because as a community mental health center, there's private companies coming in that recruit away the help. They're able to get, pay higher prices. So there's just there have been challenges, and but luckily we're starting to have some successes. I just wanted to note too, I think one of the problems that is associated with the education and the stigma, we have a funding source that believes that we should attain a 50% success sobriety success rate, and that's also been an impossibility. That's something that's not statistically viable according to Kaplan and Sadok's synopsis of psychiatry, but also, we've seen just a lot of runaways out of treatment, but we keep getting them in and keep back in. So it takes a lot of patience dealing with the MAT population, and that's our report.
Thank you, Barbara. I appreciate your input and contribution to the discussion. For the sake of time, I want to make sure we have enough time to go over the SARDI presentation. So I am going to pass the call back to Philip. If you have further questions or comments about some of the things we've talked about today, feel free to put them in the chat, as well as time progresses, impact stories. We love to see and hear impact stories about all of your projects throughout the continuum of care. So if you have any particular impacts in your community with individual clients, please feel free to send them my way, de-identified of course, and we would love to include them in our reports to SAMHSA. So with that, I will pass the call back to Philip and just say a true thank you for all of your hard work and dedication to ensuring Ohioans have access to care in the Twin Valley region. So thank you.
Thank you, Ashley, and thank you for the presenters and the people in the presentation that asked questions and engaged. We love the collaboration and discussions that take place during these meetings. With that, I would like to introduce the SARDI evaluation team at Wright State University to give an update on the data collection and evaluation of SOAR 2.0.
Thank you, Philip. Good evening, everyone. My name is Brady Wilson. I am a SARDI research assistant, and I'm joined by my colleagues Angela Zaragoza, Catherine Taylor, and Jenna Killian. And as Philip said, we're just going to give a bit of a brief evaluation update regarding reporting, numbers, and training. So if we can go to the next slide, please, we'll begin. Okay, right there at the top, that shows our number of intakes that we completed from the beginning of the project all the way year to date, or at least as of January 6, 2022. So as you can see, we have completed 13,083 GEPR intakes for the project as a whole. Below that, you'll see a graph that represents our percentage of intakes meeting our 9,000 yearly goal. So even though we are only 3 months into the year 2 project, we have completed 3,327 GEPR intakes for year 2, which is 37% of our goal. So absolutely fantastic job there. If you look to the right, you'll see this broken down by program type. So we have local board with 85% at 2,829 intake GEPR, followed by community organization at 6.1%, innovation at 6.4%, and MOM program at 2%, with Ohio Start ODJFS at the very end with 0.5% with 15 intake GEPR. Moving on to the next slide, we will talk about follow-ups and discharges. So for the project to date, we have 3,366 follow-up records, which that includes both completed and administrative follow-ups. Of those, 2/3 of those were completed interviews with 2,207. This brings the overall follow-up rate of those GEPR that have been eligible for follow-ups to 27%. For our discharge, we have 1,539 discharge records, and this includes both completed and administrative discharges. Next slide, please. I also want to point out that we have made a few changes to the biweekly report format. If you look below, it is broken up into 4 columns. The first column is the number of intakes that were completed for the first year of the project. The second column has a few more components with the number of GEPRA that were completed within the last 2 weeks as of the reporting date, the total interviews completed for year 2, the number of those that were service only, and the grand total of all 3 of those previous columns. The third column, it looks at follow-ups. So how many, again, were completed within the last 2 weeks prior to the report, as well as the follow-up rate. This is calculated by dividing the number of follow-ups that have been completed year to date, or excuse me, for the project as a whole by the number of follow-ups that have been eligible to be completed, and that gives you a percentage or a rate. And the very last column is the number of discharges. So if you have any questions on this or any of the numbers reported, feel free to shoot us an email that will be posted at the end of the slide, as well as on HioMAS's website. With that being said, I will hand this over to Jenna to talk about training.
Hi, everyone. As Brady said, my name is Jenna Killian, and I'm also a research assistant here with the SARDI team, and I'm going to talk a little bit about training today. So on the screen in front of you are our training numbers for the past 3 months of October through December. As a whole, we trained 120 people during these 3 months, training 102 people on the full SOAR 2.0 GEPRA. 15 people attended our SOAR 2 refresher and update, and 3 people attended our group Q&A sessions. Now, this Q&A number might seem a little low to you, but that is simply because most of our Q&A has moved into an individual basis. We do lots of Q&A on a weekly basis with providers one-on-one, be that over Zoom or through phone calls or emails, but we are doing lots of our Q&A one-on-one now rather than in the group format, even though we are still having those if you would like to attend. This is also just a reminder that if you have new hires or people who are new to the SOAR project or the GEPRA as a whole, they are required to attend a full SOAR 2.0 training. We have had people in the past couple of weeks even trying to gain access to the SOAR 2.0 portal or asking for training materials and information who have not attended our training yet. And so just a reminder that all new hires or people new to SOAR are required to take that training. It is not train your trainer the way SOAR 1 was at one point. We had a lot of issues with that and inconsistencies, so we have moved back to requiring everyone to attend our training. Next slide, please. So on this slide is our schedule for the next couple months for training. Per usual, we have our full SOAR 2.0 trainings, we have our SOAR 2 update and refresher, and we have our Q&A sessions. You can sign up for these on our website and see the schedule there if you would like to share them with your staff. And we will drop the link to our website in the chat box for you to have access to as well. Next slide, please. In addition to our usual trainings, we are going to have some mandatory trainings for 2022. We have found over the past couple months that we have been getting a lot of questions about our follow-up and discharge interviews, a lot of confusion with those going on. And as Brady mentioned in the previous slide, the rate currently for those follow-up interviews is pretty low. So we are hoping with these trainings, it will give a nice refresh, a nice reminder about how to get these done. Again, even if you can't get the full interview done, how to do them administratively. So that will just be a nice reminder to hopefully boost those follow-up and discharge numbers. And then we also have been getting quite a few questions about the locator form and the consent form and where to find those and how to properly fill those out. So that will also be covered at the training. These trainings will be on Tuesdays and Thursdays in March. You are only required to attend one training, so just pick the date that works best for you or your staff. It's not a series, so you don't need to attend more than one, just one. And then the training will be 1 hour long. Again, just a reminder that this training is mandatory, so please make sure that you and your staff are making time to do this. Next slide, please. And then here are just some of the highlights that we've been doing in technical assistance here at SARDI the past couple months. As I mentioned, we've been helping people with follow-up and discharge interviews and troubleshooting those and helping people find the best ways to contact their clients and get those interviews done and accomplished. We've been working with clients or working with providers to work on getting duplicate client interviews deleted. That is a huge monumental task. So we've been working also with people who have had interviews that needed deleted to work on their process to make sure that that does not happen again in the future. We've also been working on making sure people know where the consent and the locator forms are and that those are filled out properly. We've been working to help people have access to the SOAR 2.0 iPortal as they are becoming trained. And then, as Brady mentioned, we added the discharge interview data to the reports on the biweekly report format so that you are able to keep track of those numbers. So lots going on, but lots of exciting things also coming as well. Next slide, please. So here is our website and our email. Please feel free to email this email at any time. It hits 6 inboxes, so you are sure to get a response. Hopefully without too long of a wait. We are more than happy to answer any questions that you might have or clear up any confusion. So please email us at any time. And with that, I'm going to turn things back over to Philip. Thank you again for all the great work that you do.
Thank you, Jenna and Brady, for your updates. We appreciate it. Just one last reminder about our quarterly collaborative survey. Just 5 minutes of your time if you can take it right after our meeting today to let us know how we're doing and give us ideas for future collaborative calls. And that brings us to the end of our meeting today. Here are some social media. We are on there with updates regarding the department. We'll take questions at this time. So if you have any questions regarding any of the content today from any of the presenters, feel free to unmute yourself and turn your camera on and ask the questions. You may also put those questions into the chat and we will answer them as well. While people are gearing up for that, I will say that there are a few things in the chat box that I will go over now. Let's see here. So Ashley, Sabella or Cabela, I'm sorry if I'm butchering your last name. It says that this may have been said already, but do you accept and provide services to pregnant women? Afet did answer that, and she said yes, they do provide services to pregnant women, and that the OBGYN physician does take on those cases, and that they have been successful with those pregnancy cases. Afet does also provide her email. For those that are tuning in by phone, it is AFETK, the @ symbol, freedomctr.net. And it looks like we have the links in there as well. So if there's any questions, feel free to turn on your camera and ask those or put them in the chat box.
Hi, this is Michaela from Adam H. Franklin County. Thank you so much for putting this together. It's been very helpful, especially to have this spotlight program with AFET. I really appreciate that. Something that Adam H. has been doing in Franklin County specifically, we've been having category meetings. So we've split up our provider projects into MAT, recovery supports, recovery housing, and outreach and engagement. And it's been very helpful doing that to have time to brainstorm with just providers that are doing similar things. With that, a couple of questions have come up, and I was wondering if it would be possible to have times where we could almost have a brainstorming session throughout the state with different categories. So for instance, a time for everyone in recovery housing to get together and brainstorm through the problems that all of us are facing, whether it be workforce shortages, giver collections, things like that. Is this something that Ohio MAS has considered or something that we could consider in the future?
Thank you for that question, Michaela. I do appreciate that feedback. It's always good to know how things are progressing in the field and what might be beneficial to you, especially with having access to other people that have similar projects. This will definitely be something that we will consider. I will talk about that collaboratively within the department, and we'll get back to you with an answer shortly.
Thank you. I know our board would really appreciate it.
Thank you. Any other questions?
Hi, Philip. I just wanted to make a note here. Jan with Lower Lights is no longer on the call, but she did add that they are hosting an education event to combat stigma on March 15th and provided a link to their website. So I just wanted to be sure that that was mentioned in the chat. Thank you.
Thank you, Ashley. All right. Well, I think that's everyone. We do appreciate everyone's time today. We did take the full hour, so thank you for sticking in with us and learning about what's going on here at the state and at the local levels. Again, our next quarterly collaborative call will be in April. Expect those invites and reminders sometime in March. We thank you for your time. Stay warm, stay healthy, and we will see you soon. Have a wonderful rest of your day. Thank you.